A new report warns Canadians are not getting enough exercise. The participation report card says less than half of Canadian adults are meeting the guidelines for physical activity. It's a number that's been stagnant for years. The report says that physical inactivity is costing the healthcare system $3.9 billion a year. The report says even a modest 15% increase in physical activity could nearly save $1 billion each year. With me now to discuss is Leigh Vanderloo, Scientific Director for Participation. She's also a part of the Report Card Research Committee. Good morning. Thanks so much for being with us.
Good morning. Thank you for having me.
So, Leigh, if you were going to give us a letter grade, what would it be?
Yeah, so we're looking at around a D minus
Oof.
based on the overall percentage of Canadians that are meeting the guidelines. I think, there's a couple key points or takeaways we want to go with in terms of this main grade. So first, this is the first national surveillance statistic we've seen since the pandemic. So the last time adults' physical activity levels were examined were in 2021, where we saw about 49% of adults meeting national physical activity guidelines. And so while we've certainly seen a little bit of a decrease, I think what's important to take away from that is that considering what we endured throughout the pandemic, the closures, the cancellations, the restrictions on outdoor spaces, and the increased screen use, it really does suggest that we were able to stabilize our overall movement. So we didn't necessarily get worse, but we're certainly not seeing the changes in the physical activity that we'd like to see in order to see not only those physical benefits, but those mental, social, economic, and environmental impacts.
Yeah, there is a lot of room to improve. What would you say was the most significant finding?
Yeah, I'd say probably one of the most significant findings for me as a scientist is definitely this idea around this persisting equity issues. It's very clear from the findings that we have included in the report card in that all adults in Canada do not have equal or equitable access to getting active. If we look from a gender perspective, we see that adults, for men, it's about 53% versus 39% of women that are meeting the physical activity guidelines. If we look at other members of national or of equity denied groups, we see that individuals living with a disability, newcomers or new Canadians, as well as individuals with lower incomes are also less likely to meet national physical activity guidelines. And so this suggests to me that it's much more than just a lack of willpower or disinterest in getting active, but that we should really be looking at those underlying social determinants of health and some of those systemic issues, so we start to see some of those population level shifts in movement behaviors.
So how do we overcome some of these barriers so that people are more active?
Yeah, so I think it's a multi-pronged solution. I think for so long we've considered physical activity a personal choice, a personal problem. And I think what we need to do is, in order to move beyond stagnation and to see these shifts, we need to move beyond this idea of that it's a personal choice and start making it a public health priority. I think the more that we shift away from the individual and consider that it's not just an issue of willpower, but more so an inability to leverage our underused resources here in Canada. We're fortunate to have the expertise, we're fortunate to have the statistics and many of the settings, but it does come down to a lack of overall coordination, fragmentation within the sector, and also inconsistent investments in infrastructure at all levels of the government. We do have a solid foundation. There are some great champions that are already doing work in this space. And I think it's time now for us to rally together to take a whole systems approach to examine how best can we collectively and coherently come together to see some sustainable and meaningful change at the population level.
Okay, I just want to pop up the report card one more time if we can and get a quick thought from you, because this really stuck out for me. We get a B for sleep? Really, Leigh? We do that well?
Yeah, absolutely. And I think, when we look at our movement behaviors, so sedentary behavior, sleep, and physical activity, sleep actually ends up being the one for adults in Canada that we're not doing as bad on. And
Wow.
this is in terms of quality and quantity.
Huh.
So it differs based on if you're a young adult, middle age, or older adults, but it actually suggests that, we're not doing as bad. There's certainly improvement, and it's more so around the quality of sleep, but the hours don't seem to be as bad. But we do know that if we were to spend less time being sedentary and a little bit more time being active, we would anticipate seeing even more improved grades from the sleep perspective as
Yeah,
well.
there's a ripple effect. All right, Leigh, glad you could join us today. Leigh Vanderloo is the scientific director for Participation.